I'm the founder of My Medical Bank. It gives me pleasure, to be here this afternoon. I like to say that it is no longer news that Nigeria faces significant challenges in the area of healthcare. Many of our doctors, nurses, and other healthcare professionals have migrated, what we call JAPA. Our public health facilities are overstretched, health records are fragmented, health insurance coverage is low, just at about 5% nationwide. I could go on. So this is where My Medical Bank comes in. My Medical Bank comes in to leverage digital technology and artificial intelligence to facilitate access to healthcare in Nigeria. So how exactly are we doing this? As a solution, we have developed My Medical Bank as a comprehensive digital platform that makes it easy for users to book and pay for healthcare services, interact with their doctors, access their health records, and manage their own health, all from the convenience of their mobile phones. So how have we progressed with this? Launched in 2018, we already developed a mobile app that is available to download globally on Play Store and App Store. We also have a web application that to date has about 10,000 users, 2,000 registered healthcare workers, and 100 healthcare organizations across 28 states in Nigeria, including Abuja. Now, the My Medical Bank app, what exactly does it do? Our platform, what does it do? How are we leveraging digital technology and artificial intelligence to address critical shortages and gaps in our healthcare ecosystem? The My Medical Bank first is Nigeria's first personal health record app. It allows users to store their health records, set medication reminders, generate health insights on their health data, such as you enter your blood pressure, your blood sugar level readings, your cholesterol readings, your height, your weight, and then it generates a number of health advisory for you based on your based on your data. What else does it do? The app makes it possible for users to be notified of any health outbreak. For instance, maybe there's a disease outbreak, through that platform users can be notified and all of that. But beyond that, My Medical Bank also brings healthcare organizations together in one place, giving them visibility and making it easier for users to find and pay for their services, such as telemedicine, clinic visits, home care, health insurance, ambulance service, and medical logistics. So let's think of it as the Uber of the health sector. So you have healthcare organizations and healthcare consumers coming together on a secure single platform. Now, lastly, I also like to say that My Medical Bank has developed Nigeria's first national health emergency portal. Now, this portal allows healthcare providers and emergency first responders, such as the road safety, the doctors, and all of that, to access the health emergency information of any Nigerians in any emergency. So, for instance, now if we have youth corps that are deployed, to go and serve somewhere, it is possible that if there's an emergency, the relevant authorities who have access to that platform can be able to get information, the critical health information, emergency information about those, about those particular individuals. Or put another way, it is possible that when a police officer is transferred from one location to another, this platform allows for portability of their health records, so that when they go to another provider in another location, it is possible for them to have their health records with them, and that facilitates continuity of care. So today, as I round up, I'm pitching for two things. Number one, I'd like to create awareness about the services of My Medical Bank, many of which interestingly are free to the public. So I'd like to create awareness. In particular, I'd like to say to our diasporans, Nigerians in diaspora who have family members back at home, that you can actually leverage this platform to arrange for healthcare services. For instance, you may be living in London, your parents are living in Enugu. Through our platform, you can arrange for a doctor, a nurse, a carer, or any healthcare, a physiotherapist to be attending to them in the convenience of their home. Or if you need to ensure that they are taken to the hospital, the platform arranges, makes all of that possible for you. The second thing I'm pitching for today is we're seeking for a $2 million we are seeking for a $2 million investment funding for 10% equity based on the valuation of $10 million in our company. Now, this funding is required for us to achieve 6 essentials, and I will itemize that quickly. So number one, we want to develop an enterprise electronic medical record to be integrated with our existing personal health record. So we've already started the developing. We have the prototype of the EMR. Now, the type of EMR we are building is different from the conventional ones that is common in Nigeria. So what we are trying to do is